Now, I would like to invite on stage Dr. Shahala Nadaf. She is a consulting homeopathic physician, a MD, and MS in counseling and psychotherapy. She has given many clinical presentations in national seminars also. Please give up to Dr. Shahala Nadaf.
Good afternoon, everybody. Dear friends, I think from morning we have been having marathon sessions, and like Dr. Nirupama just mentioned, we have been going through a lot of pathological cases. Actually, I've come with preparations for 3 cases, but I will start backwards today because we don't want to run out of time. Okay, directly we'll go for the yes, yes, Urdu. Sir, I think okay. So the reason being because this particular third case is a case of angioneuritic edema, the nosological diagnosis. Uh, Viraj, please go to the third case. Just the introduction. I just want to pay dedication to ma'am. The first slide. So friends, just in the meantime, next one. Next one. So a very special tribute and dedication to Vishwala ma'am. It still has not seeped into me at least that she's no more with us. Somewhere I'm feeling her presence lingering right from beginning. Please don't mind if I get emotional for a second. This is dedicated to my teacher, mentor and philosopher. She's omnipresent in my journey of homeopathy throughout. She was the one who has picked me up in some random seminar and brought me. Fine, sir. Yes, yes. I should say thank you to you, Kalpit, sir. I think somewhere ma'am's spirit has guided me. She said, just continue with the lecture. No more tears. Thank you. Okay. So, dear friends, we go to the last case. Like Dr. Praveen sir said, from backwards. This case is very, see, basically arterial cases, okay, nosological diagnosis of urticaria, when we understand this particular disease manifestation, you need to understand it miasmatically, and also in acute diseases, we have two main types, acute exacerbation of chronic diseases and acute diseases. So today I'm just going to talk this case about acute exacerbation of chronic disease, because this patient already had a lingering what you call case of arterial history. But the day she came to me for the first consultation, because she also was evading it, because she has two doctor brothers in her family who are rheumatologists, okay? And then she didn't want to what you call, she was very hesitant to take homeopathy, because again the thing comes up, no? Because she called me up on for the first consultation and said that I will come to you for the treatment, but then let my acute urticaria get all right. I'm already on a drug called Evil and Alarid and Belina and all these drugs names she mentioned, and once it subsides, I'll come back to you. But on the day, for some reason, when she took this medicine called Belina, I think that's supposed to be an antihistamine, did not work for her in spite of taking 3 tablets consecutively, which generally gives a very good result. So she just walked into the clinic. At that point of time, this was her presentation. Okay, she's a Parsi lady, age 44 years, a female patient in 2016, and this was after so many years of practice. This particular case, okay, I came to know later that she developed angioneuritic edema. Let the suspense go on. Yeah, this is the presentation that she came to me. Okay, the first day. Next slide. So, in short, disease information for the students. Urticaria, you all must be learning in your final year, is basically nettle rash or hives. Okay, hives are the local language what we use for the eruptions, and it's very common in many people. And like ma'am was just telling, anxiety is bread and butter. I would say skin diseases and especially articular rashes and fungal infections are bread, butter, and jam for us. Because the people are fed up of taking antifungals and antihistamines, and they expect some permanent result from us, and that is what where we have to show how our homeopathy works, or our heroic homeopathic works. Okay, so if the urticaria grows on the mucous membrane, then it develops into a very serious complication which is very bad for the doctor as well as the patient, because even we get sleepless nights, whether it's a homeopath or an allopath, because that can lead to laryngeal distress, especially if it occurs in the larynx, and it can lead to respiratory arrest and immediate death. It's such an emergency because, and especially if it occurs like how it occurred for my patient at night, there's no scope for laryngoscope also, because it has to be done within 5 or 10 minutes. It's such an emergency. Okay, so that's why this case is very, what you call, dear to my heart. Yeah, next slide please. So angioedema is a skin allergy sort of. Okay, it is, if it's not possible to identify an allergen immediately which causes angioedema. Okay, sometimes a person is eating something, he may get an angioedema within few seconds to few minutes. Okay, and urticaria and angioedema occur together. Like I told you, in this case, she had consulted me over the phone and just told me about her symptoms, that she has urticaria and the symptom, but she had not approached me for the case giving. And this occurs in 15% of population. Next slide. So this particular case, urticaria and angioedema on face, inner aspect of elbows. You have seen the first slide. Please can you go to the first slide? Just show them the pic, Viraj. The first slide you show. Picture, with the picture, yeah. So this is how the presentation was, and this whole thing had not occurred in a day, mind you. It had just started within half an hour, she told, and then she had rushed to my clinic. It was about 7:30 in the evening. Yeah, next. Yeah, so stinging pain, soreness, swelling of face, aggravation, warmth. Okay, and history of recurrent urticaria. I've already told you she had it since 4 to 5 years, but had an episode of angioedema, restricted skin and face only 1 week back, but it was not so severe. Okay, and had been on antihistamine injections also then, right? So family history, father was suffering from Alzheimer's disease, elder sister has mild urticaria and atopic dermatitis, so the tubercular myasm is quite predominant in the family. Next slide please. Next slide. Yeah, so life space also have taken. The patient is a middle-aged Parsi lady hailing from an upper nuclear family. She had a good childhood, no major emotional upheavals in childhood. She relatively had a very good childhood, no hassles in completion of her education and other things. She and her what you call husband were actually business partners in manufacturing helmets. Okay, and somehow she did not feel that she got good dues in her marriage regard as a business partner also, as a wife also. She had that sort of what you call this thing in her mind. And apart from that, she has become presently very irritable, is very indifferent to both her boys. She has 2 boys, teenage boys, and who have completed their basic education but are dependent on her. Okay, one is 18 and one is 19. And her anger has become uncontrollable, irascible, and then becomes highly irritable, and she becomes very restless at times. And her urticaria becomes intolerable, and then she becomes very restless. That's the time she gets more restless. So these are very general symptoms that I could understand in the life space also, you know. And this, luckily I had already taken this case on the phone. I knew some part of it, but now I had to attend to her immediately. Okay. So mental generals, restlessness, nervous, this is the, what you call, whenever we go for acute cases, I think most of us are going to face the same problems. Of course, we have what you call computers, we have repertorization, we can do immediately nowadays. But still, my approach is whenever acute case comes and I have to give a medicine immediately, I try to go to the non-repertorial totality. Okay, because when you take a case, even in short, you understand what is non-repertorial totality. In this case, I found there was indifference and apathy, edema, which we could see easily. Red, rosy hue was there. You saw her face. She's a fair person, no doubt about it. But in spite of that, stinging pain was very marked, soreness, intolerance of heat, even on the slightest touch. Next slide, please. So this is the repertorization which was done. And to tell you frankly, this repertorization I've done later on. It's a retrospective study of a case. That time I have just given the remedy, and I have not tried to modify in any way, simply taken whatever symptoms, I've taken the non-repertorial totality and put it up here. And the remedy which I got, you can see the first grade remedy, EPIS. Okay. Now my dilemma was before giving EPIS, because EPIS is a very deep acting remedy. Okay, I had a case which was what you call a case which was very acute, and I didn't want to give acute a deep acting remedy without studying the case properly, because I still felt I had not taken the case in detail. Okay, so go to next slide. So whenever if we have an exciting cause which can be identified, better to avoid that exciting cause till we give a constitutional remedy. Okay, for example, a patient has peanut allergy and he's getting some urticaria and then it may be landing up into what you call angiolytic edema. Better to tell the patients to avoid groundnuts till I give you a constitutional treatment, then we can see. Because the beauty of homeopathy is that just telling the patient not to avoid like an allopath does. Even an allergy specialist says avoid all these things. They do 150 test as a patch test and they say avoid all this what you call things which incite your angiolytic edema or urticaria for that. But practically sometimes it's not possible because when you see the 150 tests what we do, at least 20 are something which the patient cannot avoid. Okay, something within his vicinity. So there I think we as homeopaths have a very beautiful and a very challenging role and really a very fulfilling role in fact. Okay, when we treat the patient as a whole, there are patients, I have a patient who had a ghee allergy for almost 10-15 years. Okay, and that person can easily eat ghee on his chapati, on his bread and anything else now. Okay, so this is how it what you call happens. So if there is an exciting cause, try to avoid that cause till a constant treatment is given. And as auxiliary measures, the only thing that we as homeopaths, because we don't have immediate anti-allergens to give, so only thing what we can do is give them what we call some auxiliary measures like cold compresses and other things. Okay, but this story is for the urticaria. Okay, now next. So when Epis Mel 200 stat was prescribed, based on the evaluation of the case on repertorial, non-repertorial basis, potency was selected in 200 potency because I felt moderate susceptibility is there because the type of life space that the patient presented was not very what you call vivid. So I didn't feel like giving a very higher potency, but her physical generals were very much matching with Epis. Okay, the rosy hue, stinging pain, and then her restlessness, irritability, all these symptoms are there in Epis mellifica. So started the patient with Epis Mel 200 stat, and yeah, the patient presented urticaria initially, but later started developing angioneurotomic edema after 4 hours. Something around 7:30 she had come to me. Then I get a call around 11:30 at night, okay, that I have got what you call, this whole thing is coming up and I'm feeling some bad sensation. So at that moment I had no choice but to counsel and tell her, see, this seems like an emergency, okay, and you may have to rush to KLE, which is, we have a center there with all these things. But somehow the patient says, see, at this point of time, 11:30, my husband is not there in town, my sons have gone for some night out with their friends and I'm alone at home. You tell me what can be done. You have given me 2-3 remedies. Actually, I had given a stock of remedies for her, Rustox and Epis, okay. But the point was, I could not tell her to take acute Rustox because in my previous experiences, whenever I've given Rustox in water dose for the article rashes, they do help at least temporarily. I know it's a sort of suppression, but in emergency, I have given it. But the problem here was Epis, once remedy, one stat was already what you call given, and Rustox is very much inimical of what you call Epis. So there my dilemma started. I didn't know what to do because I was very, first of all, it was not right on my part to give her Epis. I felt later on, okay, when I retrospectively studied the case, I should have waited for some time because anyway she has developed angiolytic edema because she was off antihistamine tablets. Okay, I should have anticipated that. But that was in 2016. I have learned a lot after that. So by evening, the patient reported the medicine was given, and I told her to take one more dose of Epis, repetition of that in water dose this time. Only 4 pills, dissolve in water, 1 spoon every 15 minutes, which she did. I have written the what you call the treatment in very short, but that whole night for me and for the patient was definitely very, very bad. But lot of her physical generals got confirmed because she lives in a typical British bungalow in camp area. She said she was sitting whole night outside on the veranda with ice, what you call cubes, putting all over her face because she was all alone at home with just one maid servant who was not very educated and she didn't know what to do. And I remember till 3 o'clock, I had called her up and I was asking, how are you feeling, how are you feeling? She said, the stinging, burning pain is better, but I feel doc, it's mainly because I'm applying a lot of ice packs on myself, okay? And then by next evening, morning, she came and showed me, it was fully, what you call, swollen up. I think, just show the next picture, please, Viraj. Anyway, okay. So this is the first one. Second, yeah, next picture. So this was during the treatment. Okay, the rosy hue and all had completely come down with 7 water doses. Okay, over the night what she had taken, but still she had some sort of choking sensation. I just requested her, should we let us get an opinion, but again she denied. She said, I'm somehow generally feeling better. Now today at this point of time with a lot of wisdom, I feel in general she was feeling better, but because of my anxiety, I was still insisting, why don't you visit an allergic specialist? Let's see what is going on. And do you have Evil today with you? Please keep a stock remedy, because she didn't have it the previous night. Okay. Yeah. Next slide, please. Yeah. This is again after 24 hours. The patient was completely fine. The best part is after this episode, okay, she has never got any attack of urticaria nor angiolytic edema, but 6 months back she came to me with a salivary calculus. That I have not put in the case because I wanted to only show urticarial episode today. And she was given natrum muriaticum after detailed case taking. Natrum muriaticum is a remedy. I am just giving this additional information. And I have this thing again at 12 o'clock at night. She has got the salivary calculus in her hand and she messages me, doc, a miracle has happened. I had not told you this, but I had the salivary calculus from last 10 to 12 years. My mom also has it, but it had never troubled me. Suddenly I started getting pain, but I didn't want to trouble you at night. And she was just bearing the pain. She's a very patient that way, if you see, doesn't look like epis. So I was a bit confused initially also when to give her epis. And with that natrium remedy, the salivary calculus has passed. Now, if you see anywhere in natrium, there is no such thing that it will help a salivary calculus, but then that is a constitutional remedy. Okay, so these two remedies have helped her till date. Do you just want to see the pics of the previous two cases? Because for students, I want them to see urticaria manifestations when they walk into your, yeah, show the pic, okay. Just show the first case. Picture the first case with the repertoire sheet. This case I have repertorized later again. Acute totality was very, very clear. That's why I've taken. It's a very recent case actually. I think 2019 or 20 I've taken this. So this is how the patient presented, and just one dose of natrium 200. See, not even water dose. Just 4 pills of that. Yeah. Show me the next system. Yeah. So after treatment, this is my examination table. Afternoon 2 o'clock, I have given him the medicine. 7 o'clock again he comes and show me everything is gone. The best part again for this treatment is it's very difficult for me also to understand how beautifully homeopathy works and so quickly in acute cases also. Now it is almost, I think 21 it is case, a case of 21. Till date, no episodes. Yeah, just show the repertoire totality. It was a case of urticaria, simple case of urticaria, okay? Pardon? I didn't get you. Just 2 minutes because we are running short of time. Just show them the details once, no? Just go through the slide, breeze through the slides. It's very short actually. Leave that. Next slide, next slide. Next slide. Before that, yeah. So this is repertoire totality what I have taken. Next. Next. Anatomy 1 dose was given and SL for a fortnight. By evening it had subsided. So moderate susceptibility again. So 200 potency I have given. Fine. Next slide. This is this thing. I've kept on calling every 15 days just to check out because urticaria rashes appear very frequently. It's a psoriatic manifestation of a tubercular myasm. Understand that. Okay. So the frequency is quite often. Next slide. Next. Now this is a very common case. Again, you get into your practice. This is called as dermographic, what you call urticaria. You just put a line on the patient's skin, and there is one particular pattern which occurs. You must have seen in your Harrison's and Davidson textbooks. Okay, this one case was very good because whenever she used to wear that necklace, a typical Mangal Sutra or anything, any rash on that, she would get this type of rash. Next case. They are called as wheels. You must have learned your physiology also. So location on the upper back, anterior aspect of neck she had, sensation, itching, burning, redness. Okay, aggravation on wearing abrasive clothing, pressure due to necklace and subsequent scratching, mental and physical restlessness. Now here I will admit, I have given Rustox as an acute. You all should not do it. You all should study the case. because I was in a rush and I knew Restox because the way the patient looked with some intuition, okay, not Farrington's intuition, because Farrington says you have to use your intuition sometime, but he mentioned intuition in a very different way. I thought Restox was going to, Restox did help her, but the beauty is when I went retrospectively, what happened? Just go to next this thing. So this was life space I've taken later, okay, history of urticaria since so many 12 years of age, and she had all this physical symptoms. Go next. Okay, basically the patient is a chilly patient, desires aggravated by cold and desires milk was one thing which I caught in if you go through your Kent's repertory in desires and aversion, Restox is the highest grade for this thing. Next. So this is how she was presenting. She had rash here on the back. Next please. Next. Yeah. So again, Restox 200, one dose, water dose, no what you call no eruptions of urticaria till date. So these are three of my favorite acute cases which never required what you call another Sibilum after that, except for the Natrimur, the Epis case, which was required Natrimur to stop the entire thing. Thank you. I'm on time. Fine.